So yesterday what we talked about with diastasis recti, I just wanted to follow up because I said that you cannot exercise your way out of it. You can do a lot of things that exercise is going to help. So I would say, and this is just like a clinical thought, this is not a research thought, but maybe 8 out of 10 women might be able to exercise their way out of it. So yesterday my patient had hypothyroidism, so we did some visceral manipulation, getting her intestine to move, and then just teaching her how to activate her core. So the big thing in the postpartum guide that we're doing is teaching you the correct sequencing and correct order of things that should be turning on at certain times. So for example, as you increase, see, look at how big my bump is getting, but as this bump increases, what happens is obviously all the abdominal wall stretches out as the baby gets bigger. When muscles stretch, they become weaker. When they become weaker, sometimes your body will turn to compensatory strategies. So for example, like your hips rotate outwards, these muscles shorten, it creates low back pain. So it's just this nasty little cycle. So with diastasis recti, what we want to do is keep reminding our body that we have these muscles. So for me, during the day, I am doing the pelvic floor contraction, so that feels like I'm tucking my tailbone up and in towards the belt line and then relaxing. With diastasis rectus, it feels like I'm zipping on a tight pair of pants. So it's easier if you don't know what it is to lay down and actually do it, because if you have low back pain, 78% of people have a hard time turning this on. So for example, it took me almost 5 minutes with that patient yesterday to teach her how to use this muscle. She's like, I have no idea what this is, but that means that she's also been using her core dysfunctionally because she's been using the more superficial muscles, or like that six-pack muscle, the rectus abdominis. So again, like for me, I'm just zipping up and in, almost like squeezing my baby, but I'm not just drawing the abdominal straight back. So again, squeezing up and in, kind of like zipping tight. You'll feel that, like I showed you yesterday, 1 inch in and 1 inch down is a great way. If that pops or gets like fat in your finger, that means you're turning it on. So 8 out of 10 of you probably could exercise your way out of it. That gal, she's been doing Pilates forever, and it probably looks a heck of a lot better than when she initially had the diastasis recti. She's been walking around for 34 years with that and probably doesn't need that, and has had low back pain, foot pain with running. So that's the reason she's in the clinic. But what we want to do, what I was trying to say yesterday, is we're trying to prevent some of that stuff from happening. You can do it, but if you were to have problems still with diastasis rectus, you've tried exercising, then maybe the APTA section, if you go to apta.org, if you click the PT locator and hit Women's Health, you can find some great PTs in there. Herman and Wallace also has a directory for women's health PTs in your area. If you're still having trouble and you've tried some of the things that they say, you can exercise your way out of it. Our program will never probably say that that's exactly what we do, but we're doing a ton of stuff to prevent it, a ton of stuff to fix it. In the postpartum guide and the pregnancy guide, you'll see little asterisks about what not to do if you have diastasis recti, because there's a couple things that will be excluded and they're given a different option. Let me just touch base with you about the lunges too, and why we take it out of the guide at 24 weeks, actually, to be exact. So with lunges, during this time, if you look at this joint is super stable. So this is your sacroiliac joint. It's really rigid and bumpy in here. With the with the hormone called relaxin, this gets loose. So this ligament is the sacrotuberous ligament, goes over, and this thing is huge. This thing keeps things stable, but during pregnancy, it becomes really hard to do that. So there's so many things that we can do while we're pregnant. And I just think lunges, it'd be better. There's more advantages to keep things more symmetrical. So then my pelvis stays symmetrical. Both sides are working equally as hard. There's not muscles pulling on one side or the other. But when that hormone increases and you have this shiftiness in your pelvis, then this model doesn't do this, but if I'm taking one side of my pelvis and shifting it up and the other side, and then I'm getting into deep positions, my likelihood for sacroiliac pain or pubic symphysis pain is higher. Doing squats, doing Romanian deadlifts, those are all things that we're still strengthening those big muscle groups, but maybe just at a more appropriate time. And for us, so the APTA section is where I did a lot of the women's health courses through. And again, that's a recommendation through them, is more symmetrical movements versus asymmetrical movements at that time, just because this is so unstable. And in a typical pelvis, this should be a very, very stable joint. During pregnancy and postpartum, even while you're breastfeeding, you're still having that hormone, so it's still unstable. So that's the reasoning for lunges. And again, you can do them, but is it the best time? And that, like, if you do your risk versus benefit ratio, there's other ways that we can still work these muscle groups, but maybe not do so much damage. And I'm all about minimizing the damage that we're doing to this area at that time.